It kind of started in Italy, really. So even though my dad's American and related to Steve here, my mom's Italian, and I had a family in Italy that had a dairy farm. And kind of my earliest memories were going to the dairy farm and seeing the little calves, and I thought they were adorable. I also really liked horses for some reason. You can talk to horse people, and we don't have a good reason why we like them. We're just horse crazy. So I really liked horses. And then for my fourth birthday, I finally got my own pet. And it was a black Labrador named Buddy. And actually, that birthday was at Steve's house growing up. I don't know if you remember my birthday party, Steve. But that's when I got my first dog. And so growing up and being exposed to different animals, I was fortunate enough to have a horse. Animals do get hurt and they get sick, and you have to visit the veterinarian. And that's really kind of what sparked my interest in veterinary medicine, is that I wanted to be able to help pets one day. So, kind of with that in mind, even through high school, I wanted to keep my grades up so I could go to college, and then decided I wanted to stay local. So I went and did my undergrad degree at Cal Poly Pomona, and I majored in animal science. They have specifically a veterinary graduate school program specific to animal science. So I did that, and then was accepted to veterinary school at UC Davis. And then during vet school, most of vet school, honestly, I thought I wanted to become an equine surgeon. So work on horses only, and specifically become a surgeon and do only surgeries. And then I started to really get into ophthalmology, kind of backtracking. My horse growing up had an ocular injury, so that always kind of was in the back of my mind. And then, so right around my last year of vet school, I decided I wanted to get into ophthalmology. So that's basically just eyeballs. So I'm a little bit of a different veterinarian than you might think of when you just take your dog or cat or ferret or chinchilla to the vet for your general vaccines or your puppy wellness exam, things like that. So I do just specifically eyes. After graduation, I actually just went into general practice for 1 year in Nevada. So, what we consider general practice is me being that general veterinarian that you, again, take your puppy to, you get your vaccine. So, I did a little bit of everything with dogs and cats. Then, the following year, I did a small animal rotating internship. What that is basically it's kind of an extra year once you've already become a veterinarian to get additional advanced training in specific areas like internal medicine, surgery, oncology, neurology. So really try to focus on those things. And they always say it's a tough year. You work really, really hard, but you learn a lot. And those are also a prerequisite to get a residency, and I'll talk about that in just a second. So I did my rotating internship at the University of Wisconsin Madison. It's an awesome place, awesome campus, just really cold. So me being from Orange County, I had to adapt to the cold weather. I actually broke the handle off my car door that winter because it was so cold. It was frozen solid, and it just popped off when I went to go open the door. So I have pretty crazy stories from living in the tundra of Wisconsin. Following my year at Wisconsin, I didn't get a residency right away. So again, I kind of wanted to focus on ophthalmology. So I applied for a program that would specifically train me in ophthalmology. And they're pretty tough to get in that specific area. Usually there's about 12 positions a year open across the world. And so I didn't get one the first year, but I got another internship. So it's kind of like the level below residency at the University of Georgia in ophthalmology. So I was fortunate to get that. And I got along with the faculty really well there, and they decided to keep me on for a residency program, so for an additional 3 years. So I was at the University of Georgia in Athens, just outside of Atlanta, for 4 years total. And what I did, I just focused on learning about eyeballs in all species. So that's what's kind of neat about ophthalmology, is that I actually get to do all species. Now I mainly do dogs, cats, and horses, but I've looked at rattlesnakes, kangaroos, tegu lizards, bearded dragons, turtles, raptors, owls. So I've really looked at a lot of different species: camels, alpacas, llamas, things like that. Whereas some specialties in veterinary medicine, like surgery, you either do large animals, so basically like horses, cows, or your farm animals, and then you do small animal surgery, which is basically dogs and cats. So again, neat about ophthalmology, I'm specifically trained to do all species. So that's kind of my training. I went around the United States, in Southern California at Pomona, up Northern California at Davis, then Wisconsin, down to Georgia, and then back here in California because I wanted to be close to my family again. I was gone for a long time. And so now I work at an emergency and specialty hospital in Irvine. So that's my connection to everyone here, is Irvine. And we are an emergency and specialty hospital only. So you can't come here and get vaccines or flea preventative for your pet. But usually your veterinarian, if they have concerns, either something about cancer or the eyes or a neurologic or brain condition, we have the specialists here to kind of further look into that and help them make a diagnosis and help these pets just kind of at a higher level, be more specific in what we can do and what we can offer, because we were just trained additionally after veterinary school. So that's kind of me in a nutshell. And Steve, you want me to kind of just talk about pet care in general and kind of just suggestions, or do we want to do?
Yeah. Well, let's keep it a little bit current,
Okay.
and maybe during these times in, say, quarantine, is there anything specific or that we should be cognizant of our pets while we're all home?
Yeah, for sure. So there's been kind of, and even me as a veterinarian, I'm trying to stay up to date on these things too. Not only with always subjects in general, but just with these times, there's a lot of unknown things. I, for example, had a patient the other day come to me, and the owner said they're bumping into a lot of things. So they were concerned about the patient being blind. And come to find out, in talking to the owner a little bit more, they actually said that they've been tripping over their dog more because the dog's always at their feet. So I was like, well, it sounds like it's the other way around, like you're running into the dog versus the dog running into you. And I read an article from a behaviorist, and it was kind of interesting. A lot of animals, because they're not always so used to having us be home all the time, is that they are showing maybe different signs of behavior, especially being needy. And that's exactly how this owner described their dog. They said, it seems like he's really needy and he's always attached to us and always at our feet, and we've never noticed that. So that's kind of interesting. People are home more and maybe kind of paying attention maybe to their pets a little bit more, or just around them more, and noticing maybe some different behaviors or things that they're doing. To be honest, I was at home. I was actually sick for 2 weeks during all this. I couldn't go to work, and I realized how much my cats actually really sleep. And I was like, this is crazy. So that's something just to keep in mind. But if you're noticing a change in behavior that's worsening, or eating patterns are very different, or drinking patterns are very different, or urinating more, those are always things that definitely should warrant a phone call to your vet and or a visit. The other thing to mention about pets and during these times of coronavirus, and definitely something that we get asked about, is what's going on of transmission of coronavirus between people and pets and vice versa, especially because there's reports of it being a what we call zoonotic disease. So meaning that zoonotic disease is transmissible between humans and animals and vice versa. So you probably heard about a bat in China that gave it to a person and then kind of spread everywhere. So now people are asking, what's going on with my pet at home? There have been reports of animals testing positive for coronavirus. The ones here in the United States, the first animal in the United States was actually a tiger at the zoo, Bronx Zoo, and they think it was infected from a asymptomatic person, which means the person wasn't showing any signs, and likely gave it to the cat, the large cat, the tiger. And there were also two more reports in New York of cats getting coronavirus. And all of these cases, so not very many when you're looking kind of at the grand scale of how many people in the United States actually have coronavirus, really, we're I think at 1 million people in the United States, or maybe, right? I don't know, well, big number. And we have 3 or 4 pets. So the rate of trends in all these people, they were all COVID positive. So it wasn't the other way around. And these pets only started showing signs after these people were confirmed of being positive, and also themselves, or 2 of the cats, those owners had signs as well. So I think the big take home thing is that it is highly unlikely for pets to really give it to us, in the sense because they're not really having this disease. And I think our ability to transmit the disease to pets is actually quite difficult and hard to do, but it's not impossible. The CDC and the American Veterinary Medical Association are saying if you are sick with COVID and you do have a pet, don't get in their face and kiss on them and sneeze in their face. Stay away from them. Or wash your hands, wear gloves if you're the only caretaker for these animals. As of right now, even if dogs or cats are showing upper respiratory signs of coughing or anything like that, it is very unlikely for them to have it. And we probably wouldn't even be tested, or we as veterinarians wouldn't even test for COVID right away in these pets, because there's so many other respiratory diseases that dogs and cats can get that we're going to focus on those more.
All right. Well, we're just going to get into some questions here. What are some of the essentials for taking care of a house? Say you're a first-time pet owner. What are some of the essentials?
So I would say, as a veterinarian, the biggest thing I could recommend to start with when you get a brand new kitten or puppy, and something to look into, other than, I can talk about food and water and toys and exercise, things like that. But honestly, in this day and age, is pet insurance. So that is a huge thing, and a lot of people don't really know it exists, or unfortunately don't find about it until something's wrong with their pet. Veterinary care can be expensive, and especially with specialists, and as veterinary care is progressing and advancing so much, it definitely can be costly, especially if a pet has a pretty serious issue. So if that's something that's affordable, definitely look into it. There's lots of different companies, even like State Farm. There's can offer pet insurance, but there's also pet insurance companies specifically that only do pet insurance. So I would really recommend looking into that right away, and not waiting until there's an issue, because certain diseases may or may not be covered as a patient gets older, or they've already been diagnosed with a problem. So that's kind of my number one thing that I wish every owner actually had, because I think treatment of patients would be easier for me, and more affordable for owners. Definitely always taking your pet to the vet right away as soon as you get a new pet, just to do a once over and make sure everything looks good. Sometimes they can detect subtle abnormalities that you may not realize, and they can be addressed right away before it becomes a problem. Food, I'm honestly not too picky about food, as long as it's a pretty good quality food. Doesn't have to be super fancy. I'm honestly not a fan of raw food diets because that's been shown to have a lot of bacteria in it and can go into the gut system. Always having fresh water available to animals, just always have water out. And with that being said, and having water out, also try to take note of how much your pet drinks. Because that way, in the future, if something does change, you can say, well, I usually leave one bowl of water out a day and he gets through about half of it. But recently, I've been filling the bowl up 2 or 3 times a day. So that's a big change. So that way you can kind of quantify how much your pet is eating and drinking. We also see a lot of obesity in animals, just like we do in people. So definitely keeping your pets trim. It's really good for their overall health and especially their joints and legs and limbs and things like that. That's really important. And then, exercise is always great. Taking your pet for a walk, maybe not a cat, but a dog, taking them for daily walks is great. And, if you're going to be a first time pet owner, um, cats for the most part are pretty good, pretty easy to take care of. You have a litter box, food and water. You don't really have to exercise cats per se like you do a dog. Definitely play with them, keep them entertained and engaged. Versus a dog, depends what kind of breed you get. There's a lot of variability there, and some breeds require a lot of exercise versus some really not much. A quick walk around the block and they're done for the day. Versus something like a border collie who requires a lot of exercise and maybe even needs a job per se. You can get them into agility training or scent training. They sometimes will keep these dogs busy by teaching them to sniff out certain things in an area. So just like German Shepherds and Bloodhounds, they're used in police work and things like that, is because they like that. They're bred to do that, and they are really happy doing that and being very active. Versus your Chihuahua might be happier on your lap.
Thank you. Well, you answered a few questions that I had on this list pertaining to how much water. Are there specific foods that pets, dogs, cats should avoid? Obviously, chocolate is the one that we think of the most, but are there other foods that dogs and cats should avoid?
Yeah, for sure. So chocolate, that's a great one. Grapes are a big one. My own dog got into 2 pounds of grapes, and those can be toxic for the kidneys. And so, my own dog, I had to rush to the ER, and he vomited up whole grapes. They were kind of bouncing across the ER treatment floor, which is kind of funny looking back, but he's fine. So grapes, raisins fall into that category as well. Chocolate, avocados, onions, garlic. Those are all really bad things that you definitely don't want to give to your pets. And then honestly, I'd say in general, stay away just from people food or table scraps if you really feel the need to give your dog something, because I'm sure they're looking at you at the table with those big puppy dog eyes, as they say. You can give them like a vegetable, and honestly, things like carrots or a green bean, sweet potato, raw or baked. Don't put anything on it. Don't put extra salt or, everything bagel seasoning, whatever it is from Trader Joe's that is addicting. Just baked, warm, or just raw. My dog, personally, he loves apples, carrots, and cabbage, all very crunchy things. But those are kind of the safe things to give. The other thing that you might not think about, which is found in a lot of human food recently, is xylitol. So that is a sweetener. It's an artificial sweetener, and you find it a lot of times in gum or sodas. And they're actually putting it in a lot of peanut butter now. So that is also a very, very toxic chemical to dogs specifically. So that is a big one, and it kind of hides itself in certain foods. So before you think, oh, a scoop of peanut butter is harmless and I want to give it to them in this pill per se, that your vet maybe even gave you, just check the ingredients of everything that you're giving. And if you ever have any questions, call your vet. We're always happy to answer. We'd rather be on the phone with you and go over this than have you come in when there's a problem. So table scraps, cheese, bacon, high fatty foods, stay away from that. Those are definitely a no-go.
All right, this one has to do with allergies. Are there any hypoallergenic cats?
So that's a little bit of a one I'm not great at answering, but I'm almost positive that Sphinx cats, for the most part, are hypoallergenic. That means the caveat is that not all Sphinx cats are truly hairless. So a lot of Sphinx cats, you may look at them from afar and you're like, they're naked, but they actually have some patches of fur in some areas. So that's not a 100% rule. And so poodles, on the other hand, are said to be hypoallergenic. And there's the popular thing are doodle crosses, which are like Labradors and poodles. So you get a Labradoodle, things like that. And a lot of people claim that they are for sure hypoallergenic. They don't always come out that way. Some are and some aren't. So you don't really know until you kind of get them and live with them and find out the hard way, unfortunately, if they are hypoallergenic or not.
On the opposite side, are there dogs that people are more allergic to?
Yes, actually. And so allergies, I would say what I would call a contact allergy. Uh, Chows and Shar-Peis, specifically Shar-Peis, more than any other breed. And you can ask any veterinarian or technician in this hospital, if you touch them, a lot of us will get kind of like a red rash reaction from their hair. So those are two breeds, and like I said, specifically Shar-Peis, they have a very different texture to their fur, and also how their skin is made up. There's a reason why they have so many wrinkles, and you can kind of pull their skin in all different directions. So Shar-Peis are definitely ones that you really want to make sure you are good with a Shar-Pei before thinking about getting one. But overall, I think every dog can be pretty similar. I think it's more on the person and how sensitive you are to know if you're allergic to them or not.
All right, another question coming in. What's the easiest dog to care for?
Ooh, that.
What's the most? Let's do it both ends.
Sorry, say that again.
Let's go from both sides. What's the easiest dog to maybe care for and the most difficult to have as a pet?
All right. This might be a little personal opinion too, because I might be biased in what I think are difficult animals to take care of, maybe based more on health problems per se. I think, that's kind of like a little bit asking how easy is it to get along with people. That's really variable from every person. So just to kind of give you an example, why this question is not a perfect answer is Labrador retrievers. A lot of them are bred to hunt and can be very hyper, and you have to work with them every day. And they go running, and they really like a job. They like to go duck hunting. Versus some Labradors are super lazy, like my Labrador. You throw a ball and he looks at you and sits down. So that can be really variable within each breed. As far as maybe difficult breeds and ones that I get maybe concerned about as far as just being prepared for a lot of health issues are American Bulldogs and Frenchies. Especially Frenchies, they're very popular right now, and they do tend to have a lot of issues, and partly and unfortunately it's because people, we breed them a certain way because we think they're so cute, and they are very, very cute, but unfortunately with that comes a lot of health issues. So that is something that many of the specialists here, we see a lot of Frenchies and Bulldogs. Overall, I would say an easy dog, and also depending on your living condition, if you live in an apartment versus you have a backyard, maybe a dog that isn't so active, so you don't, if you live in an apartment, so you don't have to worry about taking them out every day and going up and down the stairs, things like that. Maybe you have a small potty pad and you can train the Chihuahua, and that's pretty easy per se, versus maybe having St. Bernard in a high-rise apartment building. So it can be a little bit difficult to tell you such a black and white answer, but I think it depends on kind of your lifestyle, your living conditions, size of dog, and knowing that you may get a dog where you meet the mom and dad of the dog and they're really docile, and then you can get a really hyper puppy. So that's always possible too.
Well, on the medical side, what's a dog that doesn't get sick a lot or does not require that usually has a good health record?
Yeah, so the saying always goes, mutts are always great dogs. Like, you get a mutt from the shelter. Hopefully that's the case, because a lot of times and as veterinarians, we study certain breeds and we find that certain breeds are predisposed to certain conditions, whether it's a knee injury or brain conditions or skin issues. And it always seems that I get a lot of owners and people that say the best dog I ever owned that never got sick was a mutt that I got from the shelter, because they're kind of just a mix of everything. So you don't really know what you're dealing with. And maybe because it's not a purebred dog, you haven't bred specifically for something that might end up with specific problems for that specific breed.
Awesome. Okay, this is not the best question, but what are some of the worst diagnoses or worst cases you've seen come into your hospital?
Oh boy. Yeah, so I won't go into detail, but and worse is can be anything from things that are really sad and disheartening, or sad diagnoses. Giving bad news to owners, that's never good. But my job here is to inform the owner and then try to make the pet's quality of life as possible for whatever time that may be. Um, I think the saddest or worst cases are cases of neglect. If a pet has been neglected and then we see them, those are really heartbreaking. But I've seen some pretty crazy things. I saw a hit by train dog in my internship that was really intense. Hit by car is not uncommon, unfortunately. And I saw a hit by train, and you might have a pretty gruesome photo or picture in your mind. It's maybe not that bad, but it was still just it's just pretty wild to see. Or dogs that have been attacked by other dogs. I've seen horses that have been attacked by dogs and with really large wounds, and those are pretty crazy and sad. Giving the diagnosis of cancer to owners is really sad and tough. And fortunately and unfortunately, I sometimes make that diagnosis, but I'm not an oncologist, so I don't deal with cancer specifically. So then that patient that I've diagnosed with cancer, I then pass that patient on to an oncologist that can address that cancer. So those are the toughest cases. I don't want to see owners upset, and I don't want to see my patients suffer. So those are anytime that's happening, that's tough. But again, my job at the end of the day is to do no harm and make sure my patients are not suffering. And even if it is a sad case, we have to get through it, and we think of options and things that we can do and offer to owners to get their pet through it.
Well, let's take the opposite side. Can you share some success stories of maybe some animals that have come into the hospital that didn't look good but left or survived or great outcome?
Yeah. I have obviously mostly eye cases now because that's specifically what I do. My favorite surgery to do is cataract surgery, which is a blinding condition in dogs. And so I'll have owners bring their dog in to get their cataracts evaluated for possible surgery. And these patients are totally blind, bumping into things. The owners feel that their quality of life has significantly decreased. They're not able to play with the ball anymore, or they can't go swimming in the pool, things like that. And we do surgery and we remove the cataract, and they immediately can see again, which is awesome. And then the first time that these pets see their owners after surgery, it's a really joyous reunion. They are dogs that come in and walk with their head low, and they're really sad, and they're really hesitant to even walk because they don't know where they are. And then when I open that door and I just let the leash go, and that dog runs to the owner and basically jumps in their lap, that's kind of the best thing for me. So those are the cases I love.
All right, we're going to shift gears a little bit right here, talk a little bit about becoming a veterinarian or working in that field. First, how many years of school or university did it take to basically get where you are today? And then maybe talk a little bit like maybe just an entry level veterinarian to, I mean, kind of the scope of schooling involved with veterinarian.
Yeah. So, well, me specifically, I was either in school, undergrad or graduate school, or some sort of training program in total for 14 years after high school. So a long time. Um, but if you are planning on becoming just I say just, and that's not a knock at all, but if you don't want to specialize and you want to become a general practitioner, so what you would do is you would do undergrad and either, 5 years, depending how long it takes you. Some people do summer school every summer and they can do it in 3 and then maybe apply to vet school a little bit sooner. And then vet school is always 4 years. You don't always get accepted right away to vet school, so there might be a little time period in there, but kind of the road to get there. If you feel really passionate about becoming a veterinarian, even if you're in high school, it's always good to try to go and find a veterinarian that maybe you can shadow, or even help out. They're probably not going to honestly let you really touch a lot of patients, maybe here and there, and especially not in the beginning. But honestly, we always say you start by cleaning kennels, and that's what I did. I cleaned out cages, and just the exposure of being in a vet clinic is invaluable. That's really good. And honestly, the more time you can spend in a vet hospital, the more you're going to really realize what it's like to be a veterinarian, and what we go through on a day-to-day basis. So that's always good for you to know if that's something you really want to do. And as you kind of build a relationship with that hospital or veterinarian that you're cleaning cages for, they might ask you to help out with something else, and then you kind of build upon that, and then plan on going to college, getting an undergrad degree either in biology, and or if that university offers an animal science program, something like that, something to look into. Most veterinary schools have pretty much the same requirements as far as classes that need to be fulfilled in order to apply. There were a couple veterinary schools that I didn't apply to because I chose not to take calculus, for example. I think there was maybe 2 or 3 out of the 30 veterinary schools, so I let those ones go because I didn't want to take calculus. But again, just kind of something to check into, and then talking to counselors while you are at college and telling them your plan to want to go to vet school. Always keeping your grades up. That's hopefully is a given. So it's definitely very competitive to get into veterinary school. They actually say it's harder to get into vet school than it is medical school, just because there's just as many people applying, but way less schools to get into. And so volunteering, getting experience, working around animals, all different kinds of animals. Don't just focus on just your dogs and cats. If you can get experience doing other things, even in laboratories, lab animal medicine is kind of something to just broaden your experience. And that's what veterinary schools want to see, is that you really kind of looked around and you've done your homework and know what all veterinary medicine is about. There's veterinarians that work on site at slaughterhouses, and they are crucial to how we get our food every day. Our food safety. There's food safety veterinarians. I had a classmate that works for the CDC in Atlanta, the Centers for Disease Control. And so there's veterinarians are everywhere. They're not just doing dogs and cats and horses and cows. We do everything, and we work alongside a lot of human doctors, physicians, to really make advances in medicine and research. And so research is a big thing too. So there's a lot out there, and the more you can get experience, the more veterinary school is going to really appreciate that you did your homework and understand that you really want to be a vet and you've looked into all the avenues and you're ready to apply.
Awesome. What are the vet schools here in California?
There's 2 vet schools in California. One's UC Davis up in Northern California outside Sacramento. And then there's a second veterinary school in Southern California called Western University of Health Sciences. It's located in Pomona, and they are sorry, one second. You can sit down. I'm just doing yeah. Okay. Yeah, you can sit down. You just have to listen to me talk. Sorry. The one here located in Pomona is a little bit different than your traditional veterinary school. They don't have your traditional hospital on campus. The students there actually do a lot of their clinical rotations at outside hospitals. So we've actually, at my own hospital here, have had students from that university spend time with us to fulfill their requirements.
All right, we're getting a little short on time. I don't know if anybody else has any final questions. You can ask them now. What animal, since you work with eyes, what animals have the best eyes?
Ooh, I think owls have the coolest eyes.
You can see the best.
And who? They see really well. So they have really neat eyes, really cool shape to them. A lot of them are very actually tubular, even though you don't see that from the outside, how they're built on the inside. They're kind of built like an hourglass. And for the size of animal they have really big eyes, and they're just really, really neat to look at, and can be very colorful too. So yeah, those are neat. Alpacas and llamas have some neat looking structures within their eyes as well. And there's certain geckos out there that have multiple pupils, which are cool. So they'll have like 4 pupils all lined up in a row. Snakes don't have eyelids. They actually just have like a firm, clear covering over their eye that they'll shed along with their skin monthly. But they actually, and certain lizards too, do that as well. So they don't have eyelids to blink. They just have what's called a spectacle to kind of protect their eye. So there's so many different animals out there, and they're all really unique. So that's another reason why I really like ophthalmology.
All right. Real quick, what are some of the specialties of a veterinarian? Like you are in, you work with eyes. Yeah. What are some of the other opportunities in specialization?
Yeah, so this is definitely a growing field, but almost pretty much everything that you can think of that humans have, we have. So we have cardiology, so just hearts. We have neurology, which is just neurological disorders and or brain disorders or surgeries of the brain and spinal cord, things like that. We have internal medicine for both large and small. That's one of the, we call them colleges, that's divided. So you either do kind of all your farm animals and large animals, or your small animals. But internal medicine deals with all of your internal organs. Like if you have kidney problems or liver issues, they're going to deal with that. Then you have surgery. Again, that's a college that's divided between large and small animals. So they do very, very specific and maybe really difficult surgeries. Unlike just a spay and neuter, they might do a surgery in and around the heart, or really complicated surgery removing certain tumors. That being said, then we also have oncology as a specialty. There's dermatology as a specialty, so skin. There's even now behaviorists and nutritionists as well. And then let me think if I can think of any other obvious one off the top of my head. We also have a criticalist. So basically really, really specialized ER doctors that do amazing work on patients that are so critical and you think they're not going to make it, and they can turn it around. Anesthesiologists, where they only do anesthesia. So we've got it all pretty much.
Awesome. So in this time of COVID-19, I believe you're at work right now, so are you still seeing animal patients, or are you doing a lot of online consultation?
Yeah, Yeah, good question. So, mostly what I do, I actually have to see the patient in person for the most part, because the eyes are a small structure and I evaluate eyes on a microscopic level. So, I actually have a microscope that I look through in order to evaluate what's going on with pets' eyes. So, I am still seeing patients, and there are some things out there that once I've talked to their regular veterinarian and or the owner, maybe they don't sound so critical and they can wait a little bit just to kind of try to keep with social distancing and not inundate our hospital with a lot of people and appointments. But for the most part, yes, still seeing patients. We are currently not allowing owners to come into the hospital. So we have a system where we are picking up pets from the owners in the parking lot and then bringing them in again, just to minimize people congregating in our check-in and check-out area. So we're just having owners wait in their car.
Awesome. All right, this might be my favorite question, and it might be one we might end on.
Okay.
Have you seen Tiger King, and what are your thoughts?
Oh man, I should have thought of this. I bet somebody was going to ask me, but I didn't even think of it. So no, I have not seen Tiger King. I briefly saw like a 2 second preview on Netflix when I was binging other shows, and I kind of had already a preconceived notion of what it would be about, and I had, and I don't really know too much about it, and I've heard that it's not too much about the tigers, it's more about the individuals in the show. I don't know. But it kind of made me sad, honestly, to think about tigers being held in captivity and not like a zoo setting, maybe with more space or maybe more responsible owners. So that was my preconceived notion. I don't know, I haven't seen the show, so I don't think that your everyday person should be owning tigers or exotic animals that can be so dangerous and require specific care. So I have not seen it. So sorry.